Across the country, nursing homes have been hit hard during this pandemic.
Well, nursing homes have really been ground zero for the spread of the coronavirus.
Some facilities have more than 40 cases.
In 1 year since the first case of COVID-19 in a U.S. nursing home, more than 170,000 people who lived and worked in long-term care facilities have died from the virus. These facilities accounted for only about 1% of the U.S. population, but made up about 35% of COVID-related deaths. As cases and deaths continue to mount, it's important to look back at the first year and understand what happened. The data tells a shocking story. According to the COVID Tracking Project, in the last year, there were more than 500,000 coronavirus-related deaths in the U.S. The hardest hit group, though, were people living and working in long-term care facilities. This includes nursing homes, skilled nursing facilities, and assisted living facilities. In nursing homes, the numbers were especially troubling. Plagued with poor staffing and infection control issues for decades, nursing homes quickly became the perfect storm for the coronavirus pandemic. In these facilities, you have people at an advanced stage with underlying medical conditions living in close proximity who rely on staff to care for them and prevent spread of the virus. In the last year, more than 9 out of 10 nursing homes had at least one resident diagnosed with the virus. And according to the Centers for Medicare and Medicaid Services, about 20% of residents who tested positive for COVID-19 died from it. For Americans who were not residents of nursing homes, the rate was only about 1%. If you widen the lens to include people who lived and worked in all long-term care facilities, they were nearly 5 times as likely to be diagnosed with COVID-19 compared with the country as a whole. And if they got it, 7 times as likely to die from it. Vaccines have been developed with remarkable speed and provide hope for the future. Data suggests a steady decline in cases and deaths following the initial rollout. But vaccines don't solve ongoing problems. Long-term care facilities nationwide still struggle with a lack of personal protective equipment, staffing shortages, and infection control. The hard-learned lessons from this past year make one thing explicitly clear. People living and working in long-term care facilities need help now to bring an end to this national tragedy.